Morning, morning, morning. Good morning. Good morning to you.
It's the month of January, and that also means Drug Awareness Month. In studio, I have with me the folks from the National Council on Substance Abuse, Natalia, Corbin, Ifill, and Mosiah, Hoyte, both counselors with the NCSA. And they're going to be doing a number of webinars as well as a school speech contest to try to raise the level of awareness. And remember, it's all about prevention. That's the theme this month. Okay, I'll start with you first, Natalia, in terms of the webinars, and what are these live webinars really designed to do?
Well, in 2020, an assessment was done on the drug demand reduction efforts in Barbados. And this assessment was conducted by the Inter-American Drug Abuse Control Commission. And that assessment discovered that the targeted interventions in Barbados to reduce stigma and marginalization surrounding substance abuse, there weren't any.
There weren't any.
So we will schedule some webinars coming up on the 18th of January and the 23rd to kind of address that. In addition to that, we also did a study that was published last year, which looked at the barriers to treatment, mainly focusing on women coming forward for treatment. And that study also recognized that stigma was also a barrier for persons seeking treatment.
Okay.
So those both that information from those two studies help us to realize that we need to do something.
More.
Yeah.
Now, with this stigma, the social aspects of it, who gets it most? The professionals, the practitioners? Who are some of the people most impacted by the stigma?
The persons with substance use issues, because they need the help, right? And if stigma is out there, discrimination is out there, and people perceive that people are rejecting them or see them in negative light, they don't want to go forward and get the treatment because they don't want people to know. They prefer to handle things on their own than get the treatment. That only makes things worse for them, all right? So those are the persons who will be most impacted or impacted in a negative way more than anyone else.
Okay. Mosiah, tell me a little bit about this school speech contest. I'm always happy when we have our young people writing and speaking and, showing that, I'm going to school for a reason. But how is NCSA going to be doing its competition, and what are the main aims behind it?
Good morning, Wendy. Thanks for those questions. I had the idea that as a part of Drug Awareness Month, a speech contest would be a great way to hear the views of the young people. They research, they write, they deliver, and I felt that was an excellent way of hearing their views, and those views could impact what we do at the NCSA as well. Because when we go into schools, we want to be effective with them, we want to meet them where they are, we want to make sure that our programs capture them. So that gives them an opportunity to tell us what they feel about treatment, what they feel about our prevention efforts, and the entire topic of substance abuse.
Okay.
So we had training in December, and we got about 27 or so students who participated from...
At which levels? Primary and secondary?
Secondary, fourth and fifth years.
Okay.
And they came and there was training because we've partnered with Toastmasters International, the Barbados arm of Toastmasters International. So we had some distinguished Toastmasters who came and trained the participants in how to deliver, how to write a good speech. And Laura Foster, our research and information officer at the NCSA, also trained in good research tips and tools that they could use so that the information they share is credible as well.
Yes.
We are having the qualifiers round on the 25th of January at Solidarity House. So all of those persons who participated in the training, they now get to deliver a speech on a topic that is substance abuse related. And then the top 12, they go on to the finals of
Okay.
the Voices of the Youth speech contest.
Okay, sounds very, very interesting. Now, have you also encouraged them to perhaps look at that same issue of stigma in their writing as well?
Yes, we have. So they are looking at the topic of, some of them have pulled the topic, so they're varied, and some have pulled the topic of stigma. Yes, I hope we get to hear from them. How were their views on stigma? Who's mostly affected, and probably some solutions to the challenge from their point of view.
Now, Natalia, in these webinars that we have coming up, how much emphasis are we paying to the language of stigma and trying to get people to use the correct terminologies as opposed to the words that we use currently to describe substance abuse?
Sounds as though you've been reading up on this topic to see what are the approaches that can be taken. I don't want to get into that too much because they will be covering that aspect, looking at how, because we have two webinars, one for the general public, and we also have one on the 23rd for practitioners, so persons who are directly working with persons with substance use disorder, or persons who might be in a helping profession and may encounter persons with substance use issues. Because even us as practitioners, we might unconsciously, and I hear it sometimes, say things which would be
a bit hurtful.
Yes.
Yeah.
So, like language, like the word addict, he's an addict, in trying to change, how we address the situation, we have to change how we speak, the words that you said just now, the terminology people use.
So what do we interchange addict with substance abuser?
No, the approach is to take a person first approach. So a
okay.
person, and you would have heard me say that earlier, persons with substance use disorder, a person with an addiction, right? Because when you say addict or, something like that, it's like that's how you're seeing the person as
just
a whole,
blanket them.
right?
Okay.
Rather than seeing that as like a symptom of the disorder, right? So we need to separate a person from that. And to do that, we use the person first approach.
Always, okay. Now, how are we going to get access to these webinars? Where are we to log on?
Okay, so we can go to our website. For the persons in the public who are not connected to the government email blast, if you go to our website www.ncsa.gov.bb, if you scroll down to the bottom of the page, you will see upcoming events. You will see a link that you can click on, January the 18th, which is the first webinar, which is this Thursday. That's for the public, and anybody can join that one. When you click on that, it's on Zoom. And you just sign up, register, information will come to me, and you just be there ready for 7 o'clock on the 18th of January.
And you're having it after working hours, which means you want more people to participate.
Correct. So we want to get a bigger reach for the one, especially for the public.
Yeah.
Because we also have to bring awareness there.
Is there possibly any research that was done to look at the percentile of individuals who refuse to go for treatment or counseling based on the stigma?
Right now at the NCSA, we don't have that kind of research. Like I said, what we would have done, we've done one where we look at females who weren't, because we recognize that more males go into treatment than females. So last year we did a study, barriers for treatment.
And you would have assumed that would have been the other way, because sometimes women tend to be more conformist and want to help the family out more. So you would think that they would automatically go for the help. But it's the men who are going forward.
Yes.
I think it's because of the family that they don't necessarily come forward, because women are going to think about their children. They're going to think, who's going to take care of the children while I'm not there? So if she feels that responsibility towards her family, that may be one of the limitations to stop her from reaching out for treatment. Not that she isn't desirous of it, but when she thinks of, what can happen to my children? Who can feed them, there's that concern.
But there's still harm being done to the children while they watch her abuse whatever the substance may be.
And that's why family then is important to offer support. And I guess the more that we...
I keep reminding people, though, that all of us don't have families.
Correct.
There's some of us who came into this world as orphans. We may not easily attach to others. So how do you help that subsector of people?
So that did come up in the same study, what Mosiah is talking about. So we learn from research. So now from doing the research, we have to put measures in place. Having that as an element, as part of treatment, mainly the residential, that comes up really in residential treatment, where they have to go many days, you know, living in a society, a facility away from home, to get the care. So having facilities where there is an area for child care, you know, where they can feel comfortable. You don't have to worry who's taking care of my child getting abused, you know, is my child getting neglected. Because even thinking about that in treatment,
it will stop you from wanting the treatment.
Correct.
Yeah.
So we now have to try and see how we can get measures in place to make sure that aspect is taken care of, that more women can come
forward.
Right. That and the other barriers that
But
came
then
up.
too is the single facility that's dedicated just to women. Is that necessarily sufficient, or the problem with our females is not as heightened as it is within the men?
I guess when those things are put in place, we will have to then see, because based on the data, you know, they can, based on the numbers they were seeing according to the study, they can handle more. So I guess when we try to address these factors and more women go to get treatment, then we will see what else we need to do. Maybe we may have to build another facility, but we would only know when
But
they
right
start.
now, we can work it through because they need to approach in the
Right.
first instance. Now, when we talking about women and abusing of substances, what are some of these substances that we do find a lot of females getting hooked on?
Things like alcohol, marijuana, cocaine, crack. Those tend to be the most common.
And what about this this thing? You hear a lot of people talking about individuals being hooked on Molly, especially when it comes to like partying and so on. You tend to hear that a lot of females tend to do both Molly and marijuana combined.
I don't know if Molly's so active
Right, not
on our local
right.
scene, to be
Okay.
to be quite honest with you. But alcohol for sure,
Right.
and marijuana, even nicotine, tobacco, there is those are substances that women do struggle with with substance abuse.
Okay. So it's a struggle, but NCSA at least is here to help with it. Now let's get back to these young people. And once this crop are selected, when will the final be?
The final will be on the 8th of February.
Okay,
Yes.
so they have some more prep time
Yes,
to
they do.
get ready.
Yes,
what's
they
the
do.
what's the big prize? Because I'm hoping it's going to be something exciting after all this work and all this research. Because this is a whole other school project.
So bragging rights won't be enough?
No, bragging rights is not sufficient. Entirely not.
So we really are working with our supporters, our sponsors, and we are going to have devices for our top 3 finishers. The top school will also have a tech prize as well, so that
Okay.
they have materials practical things
That they can then use in the
Yes,
classroom
yes, yes. So
in
that's
terms of
where we're-
continuing the message.
Yes, so that's what we're looking
Okay.
at for this first one, and hopefully it's an annual event. So as we continue to grow, the prizes become grander.
Yes, let's hope that they do become grander and grander. So let's look now at the professionals quickly, Natalia, in terms of how they have been trying to cope and, you know, navigate this path towards substance prevention and getting away from the addiction. Do we have enough of them
Professionals?
in this specific area?
I probably honestly might have to say no.
because counseling for something like anxiety is completely and entirely different to counseling for something
and
like
I
being
think-
attached
Right.
to a substance to the point where you negate all your other duties, responsibilities, forget about things like good, proper sanitation and hygiene. And we know that that's the face of addiction that most people see. But there's also the other side, and there's the functional person who's addicted. So you do what you need to do in the nocturnal hours, but by daylight, nobody would have a clue. You know, so those are the things that we have to grapple with coming up. How big do you want the webinar to be?
Well, as many people as who can come, we have at least 100 seats open. So just hurry up and sign on up and come and learn some information that we can, you know, improve the area of substance abuse treatment.
Yeah, because it's 3 days only you have, folks, just 3 days. So make sure, go find the link, keep it there on pause so that when Wednesday, the night rolls in at 7 sharp, you can begin. Who will be conducting them?
So the one on the 18th, a common familiar clinical social worker, Mr. Joe Moore Phillips.
Yes.
He'll be facilitating the one on January the 18th, and that is called Reducing the Social Stigma of Addiction. And for the one for the professionals, we have 2 individuals from overseas, Mrs. Michelle de la Cordere Blake. She's from St. Kitts. She's the director of the National Counseling Center there in the Ministry of Social Development and Gender Affairs. And then we have Dr. Kevin Goldborn, who is a consultant psychiatrist and a drug abuse specialist in Jamaica.
Okay, so we brought the big guns in.
Of course.
Well, I want to thank you both for joining me this morning. I wish you success with your webinars and with your speech contest. Good luck to all you young ones. I want to thank Natalia, Corbin, Ifill, and Mosiah Hoyte, both counselors with the NCSA, for joining us, and continue to have a great Drug Awareness Month.
Thanks for having us.
Morning, morning, morning. Good morning. Good morning to you.